epidemic in Africa. He is also joined by Dr. Merawi, and he will be talking to us about the Ebola outbreaks that are happening and in Guinea-Conakry. Dr. John will also take time to update us on the situation of the vaccine acquisition as well as the distribution in Africa. So that is our lineup for today. But before we continue, you can continue to get in touch with us when we get to the question and answer session using our usual WhatsApp number, also using the Zoom platform, both the live as well as the question and answer section on that particular platform. So my name is Wayne Musabayana. I'm head of communication at the African Union, and it is our pleasure to bring you this press briefing every Thursday at 11 a.m. East African time. Right now, let me welcome Dr. John, who is the director of the Africa Centers for Disease Control and Prevention, for his usual Thursday morning briefing on the COVID-19 situation. Dr. John, you have the floor.
Thank you, Wayne, and a very good morning to everyone and the colleagues that are on this platform, the media, the journalists, and others who have joined. As usual, we will start with the epidemiological update and then discuss what Africa CDC is doing, and we'll end up on COVID-19 with the vaccine update, which I know it is of great interest to many. So let me start with the epidemiological update. As of 9 a.m. East African time today, the world has, as we know, that the numbers continue to increase, but I'll just focus in Africa, that we have reported over 3.8 million COVID-19 cases. That accounts for about 3.5% of the total global number. The recoveries are around 89%, very good recovery. That is about 3.4 million people that were infected have recovered in Africa. The total deaths today stand at about 102,000, and to be very specific, 102,470 cases of individuals who have died. Unfortunately, our case fatality rate is now at around 2.7%, slightly up from 2.6% previous week. Now, if you look at the continent and we look at the number of countries that are accounting for about, say, 66% of the caseloads, they include South Africa, representing 39% of the overall caseloads on the continent, Morocco 13%, Tunisia 6%, Egypt 5%, and Ethiopia 4%. So let me just dwell a little bit on the case fatality ratio. And the global, just to put it in context, the global case fatality ratio is 2.2%. However, if you look at our continent, 38% of our member states, representing 21 countries, are reporting a case fatality ratio of above 2.2%. And I will not list them all because, I mean, quite, again, 21 countries in that category. So that suggests that even though our trends are coming down, as I'll discuss later, the number of people dying, of course, has increased and actually exceeded the global case fatality ratio. So just a word on the variants. 9 member states have now reported the B117 variant, and they include DRC, Gabon, Gambia, Ghana, Morocco, Nigeria, Senegal, and South Africa. Again, I'll leave it at the B11 variant. And as Africa CDC, we take an exception in labeling variants to any country. 10 member states have reported the variant, the B1351, and they include the Botswana, Comoros, DRC, Gambia, Ghana, Kenya, Malawi, Mozambique, South Africa, and Zambia. In terms of the changes, if we compare the week last week, which is the epidemiological week 6, and the current week, which is the epidemiological week 7, we observe the following trends in terms of new cases. Overall, 74,000 new cases have been reported across the continent. The highest proportion of these new cases, representing 39%, are from Southern Africa, 22% from Northern Africa, 19% from West Africa, 15% from East Africa, and 5% from Central Africa. The following 5 countries are reported the highest number of new cases over this last week. South Africa with 11,000 cases, Nigeria 5,800 cases, Ethiopia 5,700 cases, Tunisia 5,300 cases, and Mozambique 5,300 cases. If you now look at the number of deaths, that is over the last week, we've recorded of 2,767 across the continent. And this represents a 19% decrease from the previous week. If we now look at the last 4 weeks, that is the week between January 25th and February 21st, we observe an overall average decrease across the continent of 19%. And these decreases translate in the regions, the 5 regions, as follows: 27% decrease in Southern Africa, 17% decrease in Northern Africa, 9% decrease in Western Africa. However, a 6% increase in Eastern Africa and 2% increase in Central Africa. If we now look at our most populous countries across the continent, South has observed an average of 36% decrease, Nigeria 15% average decrease, Egypt 4% average decrease. However, Ethiopia has now observed about 25% average increase, Kenya 14%, rate of 11.3%. Over the last week, there was an increase of 12.6% compared to the last week, representing about 915,000 tests reported. 1,000 sequences have been uploaded into the international portal to monitor the circulation of the new variants. In terms of capacity building for Africa CDC, we continue to work with countries to support them on safe vaccination administration in the context of COVID-19. The detailed breakdown can be made available to you next week. The Africa CDC's regulatory task force has now approved the emergency use listing of 2 versions of the AstraZeneca vaccine, the Oxford vaccine, that is the ones produced in South Korea and the Serum Institute in India. As I indicated earlier, Africa CDC, in partnership with the HOPE project, will start training on vaccination of 20 countries this week. And then next week, we'll continue to do that both starting in Ethiopia and then